Hello, how are you? How are you all feeling? So, I've been working on the EQ or emotional intelligence and with many corporates. And during pandemic, while working with you, we did this EQ workshops, emotional intelligence workshops, introduce them to the different emotions and how to manage. I particularly remember about the nurses' emotions. How did they manage and how did they take over? Um, but I was asking quite a few of my doctor friends and that do you have EQ as part of your curriculum in the while you are getting ready for doctor, and none of them remembered any of this. So how important is emotional intelligence for doctors?
Very important. Very, very, very important. I remember we had a conversation some time ago where you said emotional quotient is like a bank balance. And every time there is an emotional need, you dip into it and take it and deliver whatever has to be done with your colleagues, with patients, with caregivers. And then you have to keep refilling it. Otherwise, what will happen is that bank will go bankrupt and you will. So it is so true because healthcare is whatever you may say, it is a emotionally demanding and draining profession. So yesterday, let me tell you a story. I have this patient who we operated on 3 years ago. Very, very scared, very, very fearful. Unfortunately, she came back with recurrent cancer. And then the cancer grew and grew and grew. But she never lost her faith in the hospital, never lost her faith in us as doctors. Every now and then she would come, she would cry, we would have to console her, she would be fearful. She has a daughter who's taking class 12. She has a son who's finishing graduation. Her husband is a principal of a school. And a whole lot of complex emotional issues. And she will hold on to my hands and cry. And it would, I would have to draw on all my reserves. And then at the end of that, she was getting admitted. She will say, will you come and see me again in the night? So at the last thing, once the day's work is over, sometimes you would be drained and you have to push yourself to go and meet her because you promised you will go and see her. Yesterday, she came and at the end of our conversation in the OPD, she waved bye. Okay. And she's dying. And she has sort of gotten around to the fact that she is dying. We've had several conversations. And she said bye in a way, of taking leave of me, that you've taken care of me. But she was getting admitted for a blood transfusion. So I went to see her in her room and she was thrilled to see me. And then she brought out a shirt. She was dying and she gives me a shirt. How do I respond to it? So I take it and keep it. And then she tells me, I'm going home. I may not see you again. And we have a conversation about dying, about afterlife, about meeting in God's kingdom on the other side at some point of time, about not forgetting her. Doctor, आप मुझे भूल जाओगे क्या? नहीं भूलूंगा. नहीं. And but she did not cry even once yesterday. Earlier, every meeting she would cry and yesterday, and then before I die, will you be able to come and see me at home once? Will you have a meal with me at home? I promised her I will. And so now when I go back, my first job Saturday morning is to go to her house. So to be able to, it is on one hand, it is a very rewarding and enriching human experience, to be a part of so many people's lives so intimately. Unless you actually experience it, you will not realize the fulfillment that it brings us. On the other hand, it is also very, very um, it needs to be frequently charged and recharged and recharged. And imagine if it is for a doctor like me, if it is such a big, imagine what happens with nurses who spend all the time with patients. Imagine the amount of emotional reserves they will need. Without, and emotional, to be emotionally strong, to have a reserve of, how do I put it, emotional strength that you can distribute to patients. This is something that can be learned. This is something that can be taught. It does not have to be, all of us are not born with these, traits. These can, by understanding the need for it, by practicing it, by being mindful of the need to be emotionally strong, emotional surplus, to be compassionate. These things can be learned. And I think it is very important that as human beings, we learn to build our emotional reserves. It is even more important in some professions, in the medical profession, in teachers, to build a surplus of it.
Yeah, I mean, only when you are full with when your bank account is full of, happiness
you must actually love or learn to love your fellow human beings. You must learn to love life around you. And that is not a difficult thing to learn.
So you need to learn to love.
It is not difficult. It is not difficult.
Yeah, but we are never trained to do that. I think
because we are hesitant of demonstrating love. We are hesitant.
Yeah.
We think we will become vulnerable if we demonstrate love. If my child grows up with criticism, if my child grows up with punishment at every, imagine the kind of emotional stock he or she will have. If my child grows up with open display of emotions all the time, if my child grows up with praise and encouragement being showered all the time, if my child grows up seeing support given every time he or she feels, imagine the emotional balance he or she will have. I think like taking a stand on socially relevant things, demonstrating or taking a stand to love your fellow human beings is also a human responsibility.
I think it's such a powerful thing that we really don't display love because we feel we will be vulnerable.
Yeah.
It's a part of me.
Yeah. It is okay to be vulnerable.
Exactly.
Somebody may make fun of you. It's okay to be made fun of. Somebody may reject it. It's okay to be rejected. It's all right. I think to reach out to people is perfectly okay. To ask for support or to ask if the other person is feeling well, to offer to stand by is perfectly okay. Even if somebody were to reject you, it's okay. Your intentions are to demonstrate support. Your intentions are to express love. And love is such a powerful emotion that even animals express it. And we are evolved animals. And if we don't learn to express our love, our caring, we will miss out on a very vital part of human experience. And it is love that makes the world go around. And promoting goodwill, promoting compassion, promoting love, promoting care is a very deep human responsibility. And it leaves the person who receives love fulfilled, but it leaves the person who demonstrates, who expresses, who gives the love even more fulfilled. Both parties will become more enriched because of that interaction.